name is Mark Andryczyk. I am administrator of the Ukrainian Studies program here at the Harriman Institute, Columbia University. Thanks a lot for joining us, wherever you are at this time, for our webinar that will discuss COVID-19 and specifically COVID-19 in Ukraine, some of the issues and updates on how that is playing out there. Our event is planned for 1 hour up till 1 p.m. and the format is pretty basic. I will briefly introduce the speaker, and then the speaker will have a chance to present, and then you will have a chance to send me questions, which I will pass along to our speaker for the discussion period. I'd like to begin to say that I'm very happy to introduce our speaker, Dr. Ulana Suprun, who found time in her super busy schedule to present for our program, and for people who usually listen in and look to our Ukraine Studies program for analysis on Ukraine on various issues. And I will say that Dr. Suprun is joining us from Kyiv, Ukraine. So she's very well informed, of course, on the topic. Dr. Suprun is currently heading up the NGO RQA, a newly formed Ukrainian think tank that provides analysis, research, and creating solutions in the sphere of healthcare, media and government relations, national security, and culture. Dr. Suprun served as the acting Minister of Health of Ukraine from July 2016 until August 2019. She's the founder and former director of the NGO Patriot Defense, founder of the School for Rehabilitation Medicine at the Ukrainian Catholic University, and former director of humanitarian initiatives for the Ukrainian World Congress. During her time as minister, Dr. Suprun and her team passed a sweeping healthcare transformation into law. This transformation repealed the failed Soviet system and replaced it with a modern system based on international best practices. The new system focused on primary care, provides state insurance for every Ukrainian citizen, establishes a guaranteed package of healthcare services, increasing healthcare worker salaries to market levels. It cuts corruption and bribes in the medical system and offers a reimbursement for medicine programs for patients suffering from chronic illnesses. As an indication of its success, over the course of 1 year, more than 28 million Ukrainians signed up for the new healthcare system. Dr. Suprun entitled her talk, Neglected Infections, How the COVID Epidemic in Ukraine Was Compounded by Institutional Incompetency and Media Malpractice. I pass along the floor to Dr. Suprun. Welcome.
Thank you for that introduction. I'm going to put up my slides. I have some slides to show you so that you can see some visuals as well as listening to what it is that I have to say. And here we go. There you go. So the name of my talk is about neglected infections, how the COVID-19 epidemic in Ukraine was compounded by institutional incompetency and medical malpractice. COVID-19 reached Ukraine later than in many other countries. The first case was recorded on March 3rd, 2020, and the Ukrainian government had the opportunity to prepare for a pandemic throughout January and February, and as you see here, most of March, before the number of cases started to spike. But as in many other countries, the Ukrainian government struggled to do so effectively. At a time when it was necessary to designate which hospitals would be engaged in treating COVID-19 patients, place bans on the sale of personal protective equipment abroad, purchase the testing equipment and set up laboratory testing networks, train physicians and educate patients, instead the officials told Ukrainians on television that we're ready for the pandemic. The Minister of Health and the President cited statistics on how many hospitals, how many hospital beds, ventilators, and laboratories were ready and available to respond to the pandemic. But in the end, all of this turned out to be an exaggeration. In mid-March, quarantine was announced in Ukraine with very strict restrictions. The metro was shut down, visiting parks was banned, schools were closed and people were asked to work from home, businesses were shuttered, and more police powers were given to control the public. Basically, when faced with the reality on the ground, the fallback government response as in many other cases, was to lock down and buy time. Because of the lack of honest communication, unsuccessful attempts by the president and ministry to provide for the organization of a coordinated strategy, and little improvement on the provision of medical equipment and PPE, and as you will see, disinformation from Russia media, the public was starting to lose confidence in the message and validity of the government response. No clear instructions were being provided for the medical community nor for citizens. Testing was spotty, if at all available. Quarantine began to ease in June, although other than some increase in testing from a few hundred tests a day to a few thousand, by and large, nothing else had changed. And the infection rate is steadily rising. Businesses have bankrupted, many have lost jobs, personal liberties have been curtailed, and government has become increasingly less transparent. The public, as you see here, is no longer willing to go into a lockdown, as they have seen no lasting results from that policy. Sound familiar? No country was completely ready for the pandemic, and a similar story can be told in many countries, as none of them were prepared for the scope and serious nature of the COVID-19 pandemic. However, just as patients with chronic illnesses are at high risk for COVID-19, Ukraine is uniquely vulnerable to the crisis due to its neglected infections of being a post-colonial state, of the previous and current occupation by Russia, which has resulted in weak institutions and a struggling economy, and of Russia's hybrid war consisting of disinformation campaigns disseminated by oligarch-controlled media. The Sustainable Development Goals, or SDGs, also known as the Global Goals, were adopted by the United Nations member states in 2015 as a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. Goal 16, Peace, Justice, and Strong Institutions, was meant to create advances in ending violence, promoting the rule of law, strengthening institutions, and increasing access to justice. In Ukraine, implementation of SDG 16 is extremely challenging due to the persistence of legacy Soviet governance, the challenges of the ongoing Russian-Ukrainian war and the occupation of part of Ukraine by Russian military and their proxies, resulting in a lack of strong new public institutions. Without effective, accountable, and inclusive institutions at all levels, progress in the delivery of essential services such as health, education, and others is problematic. Economic growth is also impacted by institutional strength and resilience. A 2016 study from the London School of Economics, Institutions versus First Nature Geography, What Drives Economic Growth in Europe's Regions, found that strong government institutions are more influential for economic growth than geographic conditions. The study compared whether governing effectiveness, the regulatory and legal environment, corruption, and levels of transparency had a greater role in shaping economic growth than geographic factors, such as access to coastal areas, remoteness, national resources, and arable land. The authors found that the strongest influence on economic growth was the government's institutional capacity. By contrast, adverse geographic conditions had little impact on economic growth. In 1991, Ukraine emerged from the Soviet Russian Empire, inheriting the colonial institutions that were in place. Over the last 29 years, Ukraine has struggled to break free of its post-colonial, post-occupation legacy, including the oligarchic system where a small group of old nomenclatura elite took control of vital infrastructure once belonging to the state: energy, ports, mining, banking system, and others. The colonial and occupational security forces were designed to protect the state from its own people rather than to protect the people from outside threats. Institutions were designed to control the population from above. It was a top-down system. Society relied on social networks rather than the state to meet their demands. The government, be it national, local, or even the managers within local state-owned structures, were seen as the enemy, descendants of the colonial foreign imperialistic regime. Corruption is built into the system. Almost any transaction, starting from getting your child into nursery school to appointment to a high-level political position, was associated with bribes, graft, and influence peddling. Frequent changes in government, ministers, parliaments did not allow for stability and continuity of government, which are necessary factors in policy change and implementation. There has not been a consistent movement to create an independent, strong civil service. Two Maidan revolutions, the Orange and the Revolution of Dignity, were geared to bring down authoritarian figures. But in the aftermath, few were ready to enter government service and knew how to build strong institutions. Continued oligarch and Russian control of different political factions and of key elements of the economic system led to the situation of mimicking old colonial institutions in which competency can be found only in the predominantly nomenclatura, ex-communist Komsomol or KGB origins of the majority of the post-Soviet political and economic elites. Some progress has been made since 2014. With creation of new institutions that fight corruption, such as the National Anti-Corruption Bureau of Ukraine, so far unsuccessful attempts at judiciary and security service reform, and partially implemented decentralization, medical, education, and pension reform. All of these changes have been an uphill battle in a challenging environment of the invasion and occupation of Crimea and Donbass by the Russian military in 2014, and the ongoing Russian-Ukrainian war. Ukraine is just recently recovering economically. The hybrid war is causing instability in both internal and external politics and complicating communication with the public, as information has been weaponized by Russia. Fake news, disinformation, and manipulation are the norm for most of Ukraine's oligarch-owned mainstream media. Strong governance allows for multitasking. Ukraine may be able to manage one crisis if we do it right, either the pandemic or the war or economic crisis or reforms in multiple sectors. But when there are secondary problems and new crises which proliferate on top of this health emergency, countries like Ukraine, where there's been a concerted effort by the Russians and oligarchs to take over existing and not allow the creation of new strong public institutions, we're even more challenged. We have to manage the pandemic while also strengthening governance, managing the distribution of resources, making justice more people-centered, improving transparency and accountability, fighting corruption, increasing government efficiency, strengthening rule of law, and providing equitable medical care, all while having had part of our land invaded and occupied by Russia, fighting a war on multiple fronts, including an armed conflict, disinformation campaigns, cultural and religious pressure from Russia, and international lack of support. In responding to the COVID-19 pandemic, Ukraine has been stymied by its neglected infections, weak institutions and governance as a legacy of the Soviet system, as well as media malpractice, with Russian disinformation campaigns spread widely by the oligarch-owned media. Let's take a look at how this has affected the public health system response to the COVID-19 pandemic. Since the start of the pandemic, there have been 3 health ministers in 4 months. Unfortunately, none of them was effective in coordinating response to COVID-19. Minister Skaletska hid from responsibility in voluntary observation for 2 weeks, although there was no such need. She, together with the Minister of Interior, Vakov, poorly organized the evacuation of Ukrainian citizens from Wuhan. They could not designate a location to which the evacuees would be sent and created the debacle in Novi Sanzhare. The Institute of the Study of War reported, however, that likely Russian actors conducted a disinformation campaign against Ukraine, exploiting COVID-19 fears related to the Ukrainian government's evacuation of its citizens from Wuhan, China. The campaign's tactics, timing, and nature all point toward Kremlin involvement. The campaign's false information increased distrust of the Ukrainian government, caused protests in at least 5 different towns, and forced the resignation of a Ukrainian governor. This campaign may be part of a global Russian information operation on COVID-19, end quote. Skaletska was dismissed with the resignation of Oleksiy Honcharuk and his government, so there was a change of government in the middle of the pandemic, while she was still in isolation. The second minister, Minister Yemets, was in office for 3 weeks and had no strategy at all. The third minister has fallen back on corrupt procurement practices, buying PPE for doctors at twice the price that NGOs managed to get it, and has been busy attempting to roll back healthcare reform rather than taking advantage of the progress made to improve the COVID response. Now, what healthcare reform was done, which created a healthy environment for healthcare at the time that the COVID-19 pandemic started? Clearing public procurement of corruption was part of a positive change in the last few years, a major transformation of the Ukrainian healthcare system, which was started in 2016. The procurement process was outsourced to international organizations to get quality drugs and vaccines at the best prices. A state-owned enterprise called the Medical Procurement Agency was set up to take over procurement using transparent and fair practice through the ProZorro system. 5 countries adopted the experience of Ukrainian drug procurement through international organizations because of its success. Other changes made since 2016, which built resilience in the medical system, included the launch of a medicines reimbursement program, which has been used by millions of Ukrainians, then creation of a network of cardiology centers, and the introduction of positive changes in medical education. Doctors were given access to international protocols of medical care. An e-health system was built from the ground up. The ministry also changed from the inside, creating new ethical, non-corrupt, merit-based government employment opportunities, and many young professionals applied to join the civil service through transparent competitions. Our team created new state institutions from scratch, in particular the National Health Service of Ukraine, which is a single-payer state insurance, and National Public Health Center, and strengthened the capacity of existing ones. In 2017, the law on state financial guarantees of medical care was adopted. It's based on the principle of universal health coverage through a single-payer system. In April 2018, a campaign to select your family doctor was launched, and for the first time, Ukrainians were able to choose their primary care physician, not assigned to a clinic according to their official place of residency, which often differed from the actual place where they lived. In less than a year, 25 million Ukrainians had chosen their family physicians, and 24,500 primary care physicians had joined the new system. Financing was now based on a capitation level. Physicians and nurses' salaries have increased by 2 to 4 times, and these primary care physicians and nurses became the first contact point for patients who suspected they'd been infected with SARS-CoV. On April 1st, 2020, the second stage of healthcare reform at the level of hospitals and specialized care began. This phase involves paying for services provided at medical facilities through the national insurer, the NHSU, providing for universal health coverage. In the past, hospitals received state financing based on a budget estimated by population served rather than actual services provided. This meant that the hospitals usually only had enough money to pay for salaries and overhead, and patients ended up paying over 50% out of pocket for care. Instead of continuing this implementation of healthcare financing policy, however, the new political team at the Ministry of Health tried several times to stop it or to postpone it. Minister Stepanov and the president have tried to blame their lack of coordinated response to the pandemic on the second stage of healthcare reform, even though the pandemic started in March before the second phase was set to be implemented from April 1st. The availability of a well-run primary care system as a result of the first phase of reform was paramount in easing the pressure on the healthcare system. And the fact that the hospital and laboratory systems were not ready for the pandemic was not the result of reform, but instead made it glaringly obvious that we must continue to roll out reforms to reach these areas. And there's a great demand for change among both patients and medical staff. In the 2 months since the start of the second phase of reform, more than 740,000 referrals for medical services have been issued. Childbirth has become free of charge, and women have already shared their stories about it. The guaranteed packages of services are being provided to patients, and those hospitals treating COVID patients are receiving additional payments. To continue the rollout of the healthcare financing reform is the right choice to make at this juncture, continuing to strengthen institutional capacity and provide services to the population, not to fall back on old practices, which led to the lack of capacity of the system to respond to the pandemic. COVID-19 highlighted another neglected infection, and that is Russian disinformation and media hype. I was astonished by the results of a recent poll which showed that 29% of Ukrainians believe that the novel coronavirus was artificially created and accidentally distributed. Another 37% think that it was specially designed and deliberately released. This is the result of Russian disinformation, which is aimed at undermining people's belief in what the government is communicating. Most Ukrainian media are in the hands of Russian or pro-Russian owners and local oligarchs. They broadcast Russian propaganda, specialize in divisive clickbait headlines, are masters of hype, and undermine people's trust in government and in themselves. They sensationalize the daily case rates, repeat Russian lies about how democracies have more cases indicating liberal democracy is dangerous, and going to mass in a Russian Orthodox church will not put you in danger of getting sick because God will protect you. This disinformation has caused outbreaks in many church congregations. But it's fair to say that the government has also done a lot in the loss of, in losing the battle for people's confidence. And the media uses these inconsistencies to push the agenda of undermining trust in the government institutions. First, out of fear for looking truth in the eye and communicating that truth to people, in February, instead of preparing for a pandemic, Minister Skalecka only said that we were ready. We have enough of everything, doctors, ventilators, PPE. In the end, precious time was lost. Secondly, the government and the president are not synchronized. Their messages contradict each other and sometimes even contradict themselves. Now that the number of infected cases is increasing, as you see here, the Ministry of Health is accusing people of not following the rules. But at the same time, restaurants, gyms, and cinemas are opening in Kyiv. The messaging and the actions are inconsistent. And the third, in the midst of the pandemic, the Ministry of Health senselessly intimidated people. The chief sanitary doctor admitted that washing the streets, banning people from going to parks, and checking their documents were only psychological pressure, meant to get people to take the quarantine seriously. While citizens were told that they could not gather in groups or go to restaurants, should be wearing masks, the president appears in the media walking around without a mask, does not keep an appropriate distance, is photographed sitting in a restaurant with 5 other people, all not wearing masks. In an interview, he said that he wanted to get sick to show everyone that COVID is not all that serious. In the end, when citizens cannot trust the government, they look for alternative sources of information in the media. And this vacuum of trust is filled by Russian disinformation with its fakes, manipulations, and lies. In previous years, the media, through a significant onslaught of Russian disinformation, has convinced many people that the path to the West, the pro-European path, is dangerous. This message has been recycled, and today there's a great deal of anti-American and anti-Western rhetoric, claiming that Ukraine has freed itself from Russian imperialism, is now under threat from quote-unquote Western colonialism. People were convinced that everyone who had worked in state institutions was corrupt and were criminals, and people hoped that every new government would instantly, qualitatively change the country. Today, what we've witnessed in the current government of Ukraine's response to the pandemic is a regression to old practices instead of continuance of the new practices that were put in place since the Revolution of Dignity. We see how step by step, old cadres from the nomenclatura are returning to positions of power. The old corruption schemes are returning. Communication with the public is no longer based on honesty, which results in transparency and consistency of governance disappearing. And Ukrainians are recognizing this step back. At the same time as cases are going up, the rating of President Zelensky and his team is falling. Assessing the approval of the government's response to COVID-19 in June, 38% said they approved of President Zelensky's actions and statements, and 47% had said so in May. 45% currently do not approve. In May, that number was 37%. And for the first time in the last year, since the election of Zelensky to office, the percentage of those who approve of the president's actions and statements is lower than the percentage of those who disapprove. It seems that Zelensky's team is not coming up with innovative solutions, but is proposing the fallback strategy, populism, and simple, therefore ineffective solutions to complex problems. This raises another challenge facing Ukraine today, the lack of strong, effective leaders. An effective leader can make complex, unpopular decisions, to take responsibility, to admit mistakes, ask for help or advice, to be open to new experiences and constructive criticism, to depend on expertise and evidence-based decision-making. During a crisis, there's no luxury of time to vacillate. There's no room for not admitting to and correcting your mistakes. A successful leader makes systemic decisions because there are no simple solutions to complex problems, and sometimes must make unpopular decisions, even though you're told your ratings will fall. Ukraine has great potential, both human capital and natural resources. But the question of fully implementing its potential can happen only when the tough work of creating resiliency through strong, stable institutions is done. Countries with strong state institutions are becoming stronger. Such institutions are able to help the state survive any pandemics, political storms, populist and puppet governments. While politicians may promote populism in the media, thousands of professional civil servants continue to work in the interest of society, not ratings. If faced head-on with honesty, openness, professionalism, and engagement of both citizens and government institutions, Any crisis can be seen as an opportunity, not simply as a challenge. In Ukraine, the lessons learned so far from the COVID pandemic response indicate a need to treat the neglected infections of continuing reliance on legacy institutions of the Soviet past and media malpractice. Ukraine must continue building its own new, stronger, more resilient institutions and systemically fight against media manipulation and Russian disinformation. Thank you.
Thank you very much, Dr. Suprun, for your presentation. We will now move on to our question and answer period. We have about a half an hour for that. I'll begin with a question that I have for you concerning data. A lot of the issues people are dealing with COVID is driven around data, collecting data, and passing along data in order to make decisions both to the public and among the press. So if one looks at daily counts in Ukraine of COVID's effects there, why are so relatively few cases in Ukraine now, and how trustworthy is data coming out of Ukraine regarding COVID?
Well, first of all, Ukraine didn't have a lot of testing ability and capability until the end of March and beginning of April. So in March, there were very few cases reported, not because of the low case count. It may very well have been because of a difficulty in testing. There also wasn't any clear pathways for those who suspected they may have been infected on where they should get tested and where they should go. So the primary care physicians were taking care of patients, taking care of their symptoms, but there wasn't any testing capability. And in April, when it started expanding the capability of the testing, the tests were mostly available only to those who were hospitalized and say high government officials, which of course didn't add a lot of trust in what was happening with the response to COVID-19. As time moved forward, the hundreds of tests that were done a day have now moved up to thousands of tests a day. However, the total number of tests done in Ukraine at this point is only about 790,000 for the entire country of 37 million people. And those tests don't mean that 790,000 patients were tested. That means 790,000 tests were done, because a test is done when it's suspected to give the diagnosis. Then to confirm the diagnosis, it usually is a second test is done, because 2 tests are needed to confirm a diagnosis. A third test is done when the symptoms have cleared up to see whether or not the virus is still present in the patient who was sick. So at least 3 tests are done per person. So if you look at that, only about 250,000 or so Ukrainians have been tested. And that correlates with a relatively low percentage of the amount of population that we have. The people who are being tested even currently are only those that have severe symptoms and are being hospitalized, their immediate contacts. Healthcare workers and police workers in infrastructure are being tested approximately once every 2 weeks or once a month. And they're actually getting the antibody test, not the PCR test. So they're only getting a test on seeing whether or not their body is reacting to the virus, not the actual PCR test, because again, the lack of availability of the test and the lack of the laboratory capability of the testing. And so we have a relatively low number of cases being reported. In February and March, there were a large number of people that were reporting symptoms of actually having COVID, not just infection, but having COVID that were not being reported. So I think that the case number is somewhat low. The other thing is, in Ukraine, the way that the cases are reported, pneumonia is reported as a separate illness, not as COVID-19 necessarily. So the numbers are split between pneumonia and COVID-19. And then the third, if we look at the number of deaths in the country, it's up to about 1,400, which is a relatively low number. In the United States, they're usually, the numbers are not that someone died from COVID, but they died with COVID. In Ukraine, on the other hand, it's died from COVID, and they are not testing those that had not been tested to see whether or not they're positive for the virus or not. So the numbers probably are a little bit lower than actuality. Now, in the end, we'll see when when the pandemic is over, all of the countries will be able to look back and see what the numbers were like, and also look back at the mortality rate over the months of the pandemic to see whether it has increased from the past. In Ukraine, we don't have real-time data available for mortality, so it's difficult to look month to month. And we did look at January and February and part of March, looking at death certificates that were put into through the Ministry of Justice, and we saw that there had not been a large significant difference. We'll see as time moves forward. The other aspect of mortality or lethality of COVID-19 is when you look at the average age of those who died from COVID-19 in countries such as Italy or in the UK, it's about 78 through 82 years old. It's quite an elderly population, and that's the average age of those who died. In Ukraine, the average Ukrainian lives to only age 72. So in general, the population is not in that very high risk group, but the largest number of people who died, 48%, are in the age group over the age of 50. So we are also getting mostly the elderly that are dying. Ukraine also has a different manner in which the elderly socialize and what their living conditions are. Most Ukrainian elderly do not live in nursing homes, do not live in long-term care homes. They live either alone or they live with their extended families. And because they do not socialize the same amount, many of them live in villages and they don't have a lot of contact with outsiders or with people outside of their village. And so they have a lower risk of having the virus, becoming infected with the virus. In the United States, overall, about 40% of the deaths from COVID-19 or deaths with COVID-19 related to COVID-19 were in nursing homes or long-term care facilities. And in one state like Connecticut, 60% of the deaths were in that area. In Italy, where there was a large mortality rate, their elderly population also congregates both socially and for living conditions. And with them, the same thing happened, where it was passed along very quickly from person to person. So I think that there were several things that are endemic to the Ukrainian culture. And unfortunately, because Ukrainians don't live as long as people in other countries, are not in the highest risk group. Very few children and very few young people to the age of 21 have been infected or have gotten any significant symptoms. Currently, as in very many countries, we're seeing an uptick in the number of cases, but the deaths or mortality is usually between 15 to 25 deaths every day. That really hasn't been changing. So it seems the second wave or this coming out of quarantine wave is happening in younger people or people who are more resilient and they're not having as many symptoms. There are many more infected and many fewer that actually have COVID symptoms and many fewer that are dying.
Thank you. You mentioned how different culturally, getting back to older citizens, how culturally congregate in different ways. But when I think of elderly Ukrainians, I think of churches, packed churches, and transportation, marshrutki, which something phenomena we don't really have here in the United States. How big an impact, you mentioned a little bit about the churches early in your talk, but how about these very specific, these marshrutki? It seems to me like that they've always been abused as far as how many passengers are allowed in, and these packed churches. Is that still an issue in the last few months since COVID hit in Ukraine?
Well, when the quarantine started in in mid-March, the marshrutki were stopped and all inter-oblast, between oblast transportation was stopped. The train system was stopped and metros in all of the major cities that have them were stopped. So there was no public transportation other than if you had, and only by buses or trams, and only if you had a special permission to travel. There was a limited number of people allowed in each of the buses or in each of the tram cars, and everybody had to wear masks. And there were actually police standing at the bus stops and stopping people from going on and giving them tickets if they did go on. It was an extremely strict quarantine that Ukraine was put into for about 2 months, where there was very little transportation and very little connection of people between oblasts. There were even oblasts in Chernivtsi was the first oblast that had the biggest outbreak. They were even cut off from the surrounding oblasts, and they cut themselves off from the surrounding oblasts when it started happening in their neighboring oblasts like Ivano-Frankivsk or Ternopil. Their cases started going up. They were checking people even at the major roadways and checking their temperatures before allowing them to travel in between the oblasts. All of this was a temporary measure that only delayed the virus from infecting people, because we haven't truly done anything to stop the virus. We all have tried to inculcate new practices for Ukraine, such as washing your hands frequently and using sanitizers and keeping social distancing, or physical distancing, because social distancing is kind of not a very nice way of saying it, but keeping that physical distancing of 2 meters between people when you're standing in line or when you're standing on the street. And also, if you're in a crowded room, enclosure, or in a bus or a subway, that you wear a mask so that you're not infecting anybody else, because the mask really only protects you. It's not protecting protects other people from being infected from you. It's not necessarily protecting you. Those things were not well communicated and not well thought out for all of the people here in Ukraine. And many of them, as you saw from that survey, don't even believe that the virus is either fake. In other words, it doesn't really exist and it's only in certain places. They don't know individuals themselves who were sick, so they say it probably doesn't exist. And quite a number of them also think that it was purposefully released and created in a laboratory. So there's a lot of disinformation and misinformation and manipulation of information, which has caused people to not believe that they need to do all of those things. And I think that that's what we're seeing now is this. First, there was no testing, so we didn't know how many cases we had. Then we pretty much just locked everybody up so that they couldn't pass the virus around. And so we had a low number of cases. And once we started letting people out, nothing much had changed. And so the case count is going up. We'll see as time moves forward, but what we're very much waiting for, as is the entire medical community, is that we either have treatment for the severe symptoms of COVID-19, or we come up with a vaccine that's effective enough to protect at least our at-risk groups, the elderly and those that have chronic diseases.
Okay, thank you. Now we have questions coming in. I'll try to get to them in the order that they came in. Motria Caudell asks, is there evidence that people with greater financial resources or connections are more able to access COVID testing and treatment? Conversely, are the poor, essential workers, or ethnic minorities disadvantaged in accessing care? If so, how can these disparities be addressed?
Definitely yes, because there are quite a number of private laboratories in Ukraine that are offering the tests. At first, they weren't even reporting the results to the Ministry of Health and the Public Health Center, but in time that was all taken care of. And now even those that are being done in private labs are being reported. And that is exactly why we did the healthcare transformation. Because in the past, with that over 50% out-of-pocket payments by patients, then those who had money were able to receive treatment and get what needed to get done. And those that didn't have money weren't getting that treatment. So the new healthcare system, which just started in the level of hospitalization and laboratory work on April 1st, is starting to even all of that out. There are now quote unquote free, because the government pays for them, tests for those who have symptoms, for their contacts, for those who work in infrastructure, and for those who are medical workers. Those are all provided at no cost, and there is no payment being asked for those people. If additional people want to have the test done, they have to have a referral from their primary care physician. Then they can have the test done also at no cost, because they are at high risk for whatever reason they're at high risk. But there still is a private system, a private laboratory system, that if you have money, you can go ahead and get yourself tested, even if you don't have any symptoms or anything else. Similar to what it's like in most other countries of the world, that the public system takes care of those, takes care of the majority of the high-risk patients and the ones that need to get tested, the ones that are hospitalized, the ones that have symptoms. If you want to have a test without symptoms just to find out whether you have it or not without any reason, then you're going to have to pay for it yourself. And that's actually relatively fair. When it comes to treatment, again, patients who have signed up to their primary care physicians, if they have symptoms that are not reason to be hospitalized, if they have a fever, a sore throat, a cough, but they're not having problems, difficulty breathing, and they don't need further care, then those can get cared at no cost because they've already have a signed declaration, it's called, with their primary care physician, who then takes care of them, writes e-prescriptions for anything that they may need, and so on. Those that are hospitalized receive care at no cost at the hospitals that are designated COVID-19 hospitals. So there were 242 hospitals that were designated COVID-19 hospitals. They're receiving additional financing, and their medical workers are actually even receiving higher salaries. There was a big problem with that in March and April and May, because the changes at the level of the ministry had caused a bureaucratic nightmare on what was signed and what wasn't signed, and what orders of the cabinet of ministers had to get done, and changes of budgets and so on. And finally, in April, when the healthcare reforms started and the National Health Service of Ukraine began being the single payer, they kind of organized all of that. And then by mid-May, the money and the financing, additional financing, and the additional salaries were taken care of, and the healthcare workers are now able to be guaranteed that they're getting more payment, and they're also being tested on a regular basis. There still are quite a number of problems. In the beginning, as it was all over the world, everyone was panicking about having enough ventilators, if you recall. In Ukraine, we don't have that many working ventilators that really are capable of helping patients that have acute respiratory distress syndrome, which is what happens when you have pneumonia from COVID-19, from the disease of COVID-19. And what ended up happening was there was all kinds of different information coming out, and then everybody ran, donors started, businesses and NGOs started buying up ventilators, but they never asked the hospital if the hospital had the capacity to receive that ventilator, because you have to have the electrical outlets, you have to have oxygen, you have to have an anesthesiologist, you have to have the anesthesia to put people under when they are intubated, you have to have all the equipment that's necessary for intubation, then you have to have a physician that is the pulmonologist who's taking care of the ventilation patient, and the patients stay on ventilators for weeks at a time, it's not a day. So the whole system has to be set up. And it was this lack of systemic approach in how the response was organized, even though there had been an actual pretty long period of time of 3 months in which to be able to get this done, which really was exemplified the lack of capacity within the institutions that are in the government at this time. Changing governments in the middle of a pandemic like this, changing ministers, trying to change the way that the financing is being done, and so on, all in the middle of the pandemic, really made things very difficult.
Thank you. Yeah, and here in the US, of course, especially late, we had this regional dynamic to how the virus is spreading. And we have a question from Volodymyr Kulik. How do you explain big regional differences in the scale of pandemic in Ukraine? While a large number of infections in the West and Kyiv can be explained by more intense international travels, it is not clear why some of the adjacent oblasts look so differently, like Khmelnytsky Oblast or Vinnytsia or Ternopil. What are your thoughts on this? And related, have you noticed significant regional differences in the authorities' response to the pandemic?
Definitely, there is a difference in the authorities' response. Some облдержадминистрациas or oblast governments, such as in Chernivtsi, actually were the first ones. That's where the first cases were and the first outbreak was. What they did is they very quickly understood what needed to get done even before they were getting direction from the national government. They set up their own testing system. They got their lab in order. They started finding through business donors and through humanitarian aid. They started finding tests and test kits. They isolated entire villages when there were a couple people that got sick and started testing everyone in the village and keeping them isolated so that they didn't spread it to other people. They reassigned physicians and ventilators and all other equipment that was necessary to certain hospitals, and then concentrated all the patients in those hospitals. And all of this was done before the national government even started reacting and giving them direction. So there were places like Chernivtsi that there's a Natalia Husak who worked with us on healthcare reform, really smart woman, and she helped them get everything organized very quickly. Then there were places like in Kyiv, which actually had one of the poorest responses. Even though there were quite a number of cases, the testing was very disordered. Nobody knew what to do. There weren't designated hospitals. They were sending everyone to one hospital. That hospital got overwhelmed immediately, even though Kyiv has the most hospitals per square meter than in any city in Ukraine. They started buying ventilators and giving PPE to hospitals that are not going to be taking COVID patients, but because they were just taking whatever they could get. And so Ukraine or Kyiv was actually kind of not very well organized. Now, the distribution of what's happening is quite similar to if you look at, say, in the United States. You see that places like New York very quickly had very many patients, and then that number fell, and now it's staying relatively low. So there's a peak and a trough. In big cities in Ukraine, very similar things happened. In Kyiv, in Lviv right now, Lvivska Oblast is actually the one that has the most cases. So what happens is it comes in, a lot of people get infected, it's passed into the local community, and because we had a lockdown and we weren't traveling from oblast to oblast, but everyone was staying in their own oblast, it was contained within their oblast. Once things started opening up, and even before that, when people were already tired of the quarantine and started traveling on their own, even though that wasn't permitted at the time, we started seeing small outbreaks happening in different places. Recently, we started seeing them in some long-term care facilities, because we do have some long-term care facilities. They're not necessarily for the elderly, they're for those that need 24-hour medical care. And so there have been some outbreaks in those places. And unfortunately, in Ukraine, 20% of those infected have been medical workers, because from the very beginning, PPE was not provided to them. They did not have enough. They didn't know how to use it, and it was a major problem. Promises that were made by the ministry and by the president didn't come through. Then there was poor quality equipment and PPE brought in from China, as it happened in the United States and in other countries. That stuff was just thrown out. There were quite a number of businesses here in Ukraine that started producing higher quality equipment and PPE, and now the medical procurement agency is buying internally within Ukraine. So it's actually helped the economy in some way. And I think that currently it's gotten better. But one of the big issues which had not followed through all the way to the end is that the system of public health in Ukraine only started being organized in 2016, in the fall of 2016. And even though there are technically infection control officers and infection control procedures at hospitals, not many of the doctors even knew how to use the equipment. Many of them didn't understand that immediately they should introduce what doctors call universal precautions, which means assuming everybody who you're talking to or any of your patients are positive. Many doctors actually infected other medical personnel because they walked out of a patient's room, didn't wash their hands, didn't take their mask off properly, came into the doctor's lounge and infected others. And there have been pockets of doctors, many doctors and nurses being infected at certain hospitals. That's starting to come down, and now it's down to only 10% of each of the current day's cases are physicians or nurses or people working at hospitals and people working in laboratories. but it's still a significant amount. And that is part of the challenges we have in Ukraine. I think that the physicians, the public health system, the laboratory system, the nursing staff will now take infection control much more seriously.
Thank you. We have several questions I'd like to get to. Ulana Suprun is asking, if you were reinstated as Minister of Health today, what would be your top priorities in terms of managing COVID-19 pandemic in Ukraine, the top priorities?
My top priority would be to have a cabinet of ministers that's functional, because the Ministry of Health is not the only ministry that's involved in any pandemic. You have to have the Ministry of Interior involved. You have to have the Ministry of Finance involved because you need money. The Ministry of Economy involved because there's a lot of imports and exports and a lot of changes in the economy that are happening. You have to have the Ministry of Foreign Affairs involved because you're dealing with a lot of partners. And you have to have the Ministry of Infrastructure involved because we're talking about all the transportation and everything else that's going on. We also have Ministry of Social Policy, which provides social services, and all of the ministers or all of the ministries should be coordinated. In the Ministry of Interior is our Department of Emergency Services, and they also need to be involved in what's happening. So in Ukraine, we have a flood in Western Ukraine, in Zakarpattia region, Prikarpattia, and that on top of a pandemic is really straining everyone. So my first priority would be to make sure, and if I came in parachuted into the government that's in place right now, I don't think I could do that much. But if there was a full change of government and different people came in, then that would be coordinating the actions of all of the different ministries together, number one. Number two, coordinating the communication so that there's clear instructions by trusted individuals, including physicians, coming out and saying what the physicians and what people should do. That would be very, very helpful. And then third, I would increase testing dramatically by buying more tests and improving the lab system so that we can do a lot more testing, so that we could isolate, we could track all of the contact people and isolate them, because I think that way we can actually get a better idea of how many people may have already been exposed to the virus, how many people have developed immunity to the virus, and how many people are contacts and need to be isolated from passing the virus along to others.
Thank you. Question from Alexander Motil. Are any Ukrainian labs working on antivirals or vaccines? Does Ukraine produce its own masks, or are they imported, or are they homemade?
Salute to you, Alexander Motil. Nice to see you. Nice to hear you. And Ukraine is making its own masks. There are the medical masks that are being made, the N95 respirators, they are being imported because we don't make them in Ukraine, but the surgical masks are made here. People have been, the public has been encouraged to not buy up medical masks, but instead to use cloth masks. And if anything, Ukraine has become very creative in the cloth masks that are being made. Many of you, if you've been to Kyiv, you know how in the underpasses, when you go under the streets to cross the street, or when you go into the subway, they have a lot of little kiosks there. Half the kiosks are now selling cloth masks, and all of them have different designs on them, and you know, some of them are Vyshyvanki and some of them are others. So they've actually done quite a good job in kicking up and coming up with nice ideas on how people can buy masks. All over the world, where it's getting warm now, summer months, it's difficult with the masks because people get very hot and sweaty underneath them. And so there's been a lot of attempts on trying to make them more comfortable for people. Ukraine is not working on vaccines and does not have the capacity to do so. But Ukraine is involved in several, well, at least in two that I know of, large clinical studies when it comes to antibiotics. And it's the study on the anti-malaria medicine and azithromycin that the World Health Organization is doing. Those are now being stopped because they haven't shown that there has been any positive effect from them. And Ukraine has a few of its own medications that it has come up with in the past. And there are some small studies happening with patients to see whether or not it's going to improve the patient care at all. I have very little hope that they actually will, but at least some of them are trying. Pretty much Ukrainian medicine is trying to follow closely the changes that are happening in the international community. Unfortunately, not many Ukrainian physicians speak English, and so they wait for the Ministry of Health to give them some sort of instructions. And the Ministry of Health, the last time they updated the treatment protocols was in April, I think, which means that they're old, because I read every day the changes that are happening. So there's a lot of difficulty in the physicians not knowing what to do. So we've sort of created, physicians in Ukraine have created small chats. Say the anesthesiologists have a chat. And so we'll drop in new protocols and translate it for them so that they see what it is. And then the infectious disease doctors have their own chats. And so they're trying to sort of keep on up on the most current protocols, not waiting for the ministry to tell them. When we were at the ministry between 2016 and 2019, we actually passed an order of the Cabinet of Ministers that for the first time, Ukrainian physicians are allowed to use international protocols of care, of treatment, if they come from a certain list that is approved by the Cabinet of Ministers. So if, say, Ukrainian has cancer and their oncologist can use the National Cancer Institute's treatment protocols, because it is now legal for them to do it. Until we passed that order, it was illegal for them to do it. They could only use those protocols that were passed by the Ministry of Health, and those were 5 to 10 years outdated. So those doctors are safe in being able to use those international protocols, legally safe.
Yeah, it was several weeks ago, I was reading about COVID in Ukraine, the idea of trust, who the citizens trust, and doctors were mentioned in many articles as like the first person that they're asking, trying to get information about the pandemic. And we have a related question from Elise Giuliano. Do you think that Ukrainian citizens have increased their trust in their regional/local governments at the expense of the federal government as a result of the way that each has responded to the pandemic? And does it depend on the region/locality? Thank you.
It's a very good question. I think that it does depend on the region and locality. In some places, they continue to look to the Ministry of Health or the national government to give them guidance. In those places where there are proactive, strong governors, leaders, they have taken responsibility on themselves and they have moved forward. Cities are like that as well. Say the city of Lviv, where we have Andryczyk, who's a good mayor. He has been effective in getting business involved. They needed equipment for their laboratories. They found donors to buy the equipment. They've organized testing facilities in places, surprisingly, places like Sumska Oblast. They actually also have done a really good job in getting themselves organized. So there are certain places where things are being done well. Donetsk Oblast, the part that is not occupied, but the part that is under Ukrainian control, has been one of the most advanced when it comes to electronic medical records, reporting problems, instituting the orders of the Cabinet of Ministers or the Ministry of Health, coming up with their own ideas of how they should do things. They've also been quite good at what they're doing. The problem right now is not necessarily a disbelief or a lack of belief in just the president or just the local governments. It's a general lack of belief in whether the COVID-19 pandemic was real or not, whether too much was done to close everything down, whether all of this was done to hide something else that was happening, because of this lack of transparency now, the court proceedings are often closed, Cabinet of Ministers meetings are closed, the meetings of all of the committees on healthcare are not being done publicly. A lot of laws and ukaze and orders are being passed without people even knowing what's going on. There's been quite a number of arrests, as you probably have heard lately. The ex-president, the ex-minister of the Interior have cases against them. There are activists that are being persecuted, basically, like Serhii Sternenko. There are cases that are not being investigated properly, like the case of Sheremetas and with the 3 people that they've arrested that seem to have had nothing to do with his death, or the case of Katya Handzuk, which they just pretty much let go and haven't been doing much of anything about. So there's quite a bit of a problem going on. And unfortunately, what's happened, as it has happened in a number of other countries, is because of the pandemic, Ukraine is starting to turn into more of a police state. The police are being given, and the security services are being given a lot more leeway and a lot more money and a lot more authority than they had in the past. And it's making civil rights activists and human rights activists and organizations quite nervous about what's happening.
Yeah, all right. Well, we're almost out of time. We actually are, but we'll just do one more question. Has DNA testing been done on patients in Ukraine to show whether the prevalent COVID-19 strain was transported from Western Europe or Asia? Is there a way of determining that?
The tests haven't been done as far as I know. Nothing that has, if it has been done, it hasn't been made public at all. So I don't know about that. And I can answer really quickly. I see the questions here about the pandemic has increased communication cooperation between the rebel and I wouldn't call it rebel occupied areas because they're not rebels. And it's Russian occupied areas is actually the way that should be written. And the Ukrainian government, crossing points were closed down because of the pandemic. And once they opened on the Ukrainian side, the Russian controlled side was not letting people out. And there's an exam that has to be done by Ukrainian students so that they can get into university. It's kind of like an SAT. They weren't letting students out, even though they wanted to come into the Ukrainian controlled territories and take these exams. It's been a little bit difficult, and only patchy information from the Russian controlled territories. So not sure about what's going on there. The OSCE has stopped its mission, and they're only taking reports. They're not really, the mission isn't active anymore because of the difficulties with the pandemic. And every day there are Ukrainian soldiers that are either killed or injured, and civilians about twice a week are either killed or injured because of continued continued conflict. And then the transborder relations, traveling for work and goods, moving from the EU and Russia into or out of Ukraine.
The neighbors.
The borders are quite porous. Let's say that. Very porous. And there's been a lot of travel back and forth between Poland, Romania, Hungary, and Ukraine. That's just the way that things are happening. Many Ukrainians, a couple 100,000 of them actually returned to Ukraine from being outside of Ukraine at the beginning of the pandemic. And many of them are now starting to go back out into those countries. Poland and some of our neighboring countries, they allow Ukrainians to cross the border if they have a work permit or if they have a residency permit in their countries.
And the final question we have, if we can squeeze this in, does Ukraine have small number of deaths compared to statistics in Russia and Belarus? Do the statistics match these of its neighboring countries or not, and reasons for discrepancies?
There's been a lot more testing reported in Russia and Belarus. So they have more positive infections because they've tested more, or at least they report that they're testing more. And of course, Russia is much larger than Ukraine and has a much larger population. So they have quite a bit higher. Russia is now, it was third, but now I think it's fourth of the number of deaths mortality from COVID-19 in the world. So there's a large number in Russia. In Belarus, there's less. They've done more testing than Ukraine, but their numbers are closer, more similar to what Ukraine has. Again, it's difficult to know how accurate these statistics are, especially with what's going on in Belarus right now. Belarus wants to, the Lukashenko is not really sharing a lot of information. And then the last thing I want to say about the churches, because I didn't answer that question earlier. Yes, there was a big problem in the beginning because neither the Catholic Church, nor the Ukrainian Orthodox Church, nor the Russian Orthodox Church wanted to stop having masses. Only after the quarantine was put in place did the Catholic Church and the Ukrainian Orthodox Church stop. The Russian Orthodox Church continued to have masses. And even though there were police standing outside the churches and they were supposed to make sure it wasn't crowded inside, all the people were coming and going. And at Pecharska Lavra, which is one of the major seats of the Russian Orthodox Church here in Kyiv, there was a big outbreak amongst the priests and the monks there, as well as amongst those people that came to church, the churchgoers, as there were in other villages. Eventually, the Russian Orthodox Church also stopped having masses, but it was a big problem for a long time. And they even had marches in Vinnytsia to say that, you know, we're going to stand all together and we believe that we won't get sick because we're in the Russian Orthodox Church. And their patriarch was telling them so.
All right. Well, thank you so much. I think we'll wrap it up there. Thank you so much, Dr. Suprun. Talked about so many different aspects of this pandemic and how the specific issues that Ukraine is dealing with beyond it have affected it. But also looking forward and ways of possibly getting through this. So thank you so much for your expertise, for finding time to share with us. And we hope to have you on campus for talks sometime when that is possible.